Welcome to the She Found Motherhood podcast. Today we're talking about all things pain management in labor. There are medicinal or pharmacological options, and there are non-medicinal or quote unquote natural options. We'll discuss all of them. We are going to focus a little bit on the epidural as we get so many questions, both from patients, but also on our social media around epidurals. So we've also created a handy dandy little epidural sheet. So make sure that you download that to get even more information around risks, benefits, pros, and cons of epidurals in labor.
Welcome to the She Found Motherhood podcast. We are doctors Sarah and Alicia, maternity physicians and moms who have been through it all. We want to empower you with knowledge so you can have the best pregnancy, birth, and postpartum experience you can.
She Found Health and She Found Motherhood is meant for general medical information only. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. This information does not apply to every situation. If you have questions or if you've received different advice, please contact your healthcare provider. Always seek the advice of your physician or another qualified health provider with any questions you may have regarding a medical condition. The views expressed by She Found Health and She Found Motherhood and our guests are not representative of any of the institutions with which we are affiliated. Some of our podcast episodes are sponsored so that we can keep getting great info out there to you, our listeners. We only partner with companies that we truly believe in. Some of our links and suggestions may be affiliates, and we would appreciate you using them to help fund this important work. Now let's get to it.
Hey guys, it's Dr. Alicia and Sarah here. We're going to talk to you a little bit about pain management in labor, and then we're going to focus this on epidurals because we always have a lot of questions, both from our patients but also on social media around epidurals. So we thought we'd focus in a little bit on that. So this is a topic that a lot of people want to know about. Know that we have a full module in our online prenatal course about all of the pain management options, both medicinal and non-medicinal or natural. So go check that out if you want more info. But we get so many questions, like I said, around epidurals specifically, we thought we'd share that part of the information with you. Now, between 50 to 60% of birthers in Canada get an epidural. And so it's good to think about it and understand what are the risks and benefits, the pros and cons about getting one if you're thinking you might be interested in getting one in labor. But some people don't even think they want one and they end up getting one just because life happens. And so it's really good to educate yourself on what the possibilities are around pain management in labor. So we also touch briefly on spinal anesthetics as well. And these are what are used for a cesarean section, generally speaking. If you don't want an epidural, good on you. But we love supporting people in their journeys, whatever they choose. But we also know that many people going into labor don't necessarily want an epidural. But at some point during the process, they do change their minds. So again, good to know about.
So let's start by talking a little bit about labor. Here's a great quote on pain for you, which always makes me think about how much our current circumstances, previous experiences, and so many other factors contribute to how we experience it and cope with it. Sleep is a huge factor in this, and for some people, early labor can last for days. So by the time they even get into active labor, they can be exhausted. The way pain is experienced is a reflection of the individual's emotional, motivational, cognitive, social, and cultural circumstances. So the two main influences on a birthing person's ability to cope with labor pain are 1, continuous individualized support during labor. So this could be a supportive partner or friend or professionally trained doula. And 2, acceptance that some pain is necessary to birth your baby.
And if you guys are looking to learn more about what a doula is, we certainly have a podcast episode on what a birth doula is and how they can support you. So let's chat a little bit about early labor support, as this is often when you're at home and you could really use a little bit more support. We have a great handout for partners on how to support their pregnant person in labor. So make sure to download that for your partner, or if you are a partner listening to this, download it for yourself. Or better yet, have them listen to this podcast so you guys can have some good discussions on what you can do as a team during labor. So we'll make sure that we link that download in our show notes below.
So starting with some non-medicinal or natural methods, acupressure can be really beneficial. And Stephanie Curran, who is a local acupuncturist, actually did a great video for us in our prenatal course on acupressure points and breathing techniques in labor. So it's important to know that there is some evidence for this. A Cochrane review concluded that acupuncture and acupressure may have a role with reducing pain, increasing satisfaction with pain management, and reduced use of pharmacological management. And this was published in 2011, so this has been around for quite some time.
So breathing techniques can also be very beneficial. Now, Like we said, Stephanie Curran did that video for us around breathing techniques in labor. Some people know this as quote unquote hypnobirthing, but really what we like to call this is mindfulness in labor and birth. So we've touched on this briefly, and Stephanie Curran does discuss this in her segment on acupressure and acupuncture of how beneficial actually learning how to breathe properly and using that during your childbirth experience can help with pain management.
Yeah, and we even have a handout in our prenatal course
Mhm.
around breathing and mindfulness. Water is a great tool, and it can be a really amazing way for some people to help decrease the sense of pain during labor. And for some birthing people, it helps them feel more in control, have more ease of movement into positions that can make them more comfortable. And some people even choose to give birth in the water as well. That is outside of our scope as we don't do this, but we'll post below in the show notes a podcast we did with a local midwife that is all about water birth.
Now, we do need to make sure that we're safe when we're using water during labor. So, just as a quick reminder, here are some of our tips around keeping you and your baby safe if you are spending some of your time in water. So, one, you need to have a healthy pregnancy. You need to be at least 37 weeks of gestation or later. You need to be in a warm, not hot bath. So, we're looking at 36 to 37.5 degrees Celsius. We recommend you getting out of water every hour or so to empty your bowels and bladder and to ensure the well-being of your baby and allowing your body temperature to equilibralize. We want to ensure that you're staying well hydrated throughout while you're in the water and just during labor in general. We recommend not having any strong medications such as morphine on board because that makes it more likely you might fall asleep in the water. So if your care provider has any concerns with your well-being or your baby's well-being, they're going to ask you to leave the water. And so respecting and having a discussion with them around why, especially if you're interested in not leaving the water. Those are some tips around laboring in water. So in a bath, less of an issue when you're in a shower, but certainly in a bath, you want to be making sure that you're following those guidelines to keep yourself and your baby safe. So we're going to get into epidurals. So first of all, what is an epidural? Epidurals is medication placed around your spinal cord to help decrease pain sensation. So these are placed by anesthesiologists or family doctors with extra training in anesthetics in some smaller communities. And they are the most effective form of pain management that we have in labor. The procedure for having an epidural placed is that the physician will discuss the risks and benefits of an epidural to you at the time, and you must consent to this. Now, as you can imagine, you might be in a bit of pain during this time, which is why we think it's really important to read over information beforehand. So we've created a handy free download all about epidurals. So check out our show notes and we'll post it there so you can have a look and understand what an epidural is, how it can be a benefit, what are the risks and associated with it, so you can make an informed decision for yourself and have those conversations with your support team prior to going into labor.
Once you've spoken with the physician that's going to be performing the procedure and you've made an informed choice to go ahead and get an epidural, you'll be asked to sit up in your bed and lean forward. Often we'll have you hugging a pillow to round out your lower back and make more room in between the bony vertebrae. Your back is then wiped with a cleansing solution, which can be a little bit cold, so they usually warn you before they do that. After the area has been thoroughly cleansed, some freezing is placed in the skin and underlying tissue. This often feels like a bit of a pinch when the needle goes in, and sometimes a little bit of a burning or like a bee stinging sensation as the freezing is placed in the tissues. It usually takes a couple of minutes for that to happen. Now, don't forget, during this time, you're continuing to have contractions, so the anesthesiologist will try to time all of this to do it in between contractions. But you also have to do your best to stay as still as possible during this time. I remember when I was getting an epidural, I was squeezing my husband's fingers and he had his wedding ring on and he was like, "Can you stop?" And I was like, "No." So squeeze two fingers.
Yeah.
Squeeze two fingers.
Or one,
Much less
either
painful.
one. Yeah. Or at least one without a ring on
Yeah.
it. So once the freezing has taken place, a needle is used to find the epidural space, and a small, flexible plastic tube is fed into this correct area. This is left near the nerve roots, so in that epidural space. So it's in between, it's outside of the area where your spinal cord is, but close to it. So the numbing and pain medication is then provided. You get a dose right off the bat to make sure that it's working well, and then you get this continuous flow of medication throughout your labor and delivery process. And once you've had your baby, the epidural is removed after the delivery of your baby and delivery of your placenta, and if you need any suturing or any other procedures postpartum. Hey Sarah, do you know what I've never asked you?
Did you take a prenatal course when you were pregnant?
We did. Even though I'm a maternity care provider, my husband and I thought it would be an important process for us to go through together.
That's so cute. It must have been so hard for you guys to coordinate your busy schedules, though.
Oh, tell me about it. I was a medical resident at the time, and he was working full-time. We really struggled to find a course that would fit our needs and ended up doing a semi-private course that still was challenging to schedule and quite expensive.
Wouldn't it have been nice for you guys to have access to an online course with evidence-based content that you could do from the comfort of your own home or on your own time at your own pace?
You're telling me if I had had access to something like our Pregnancy to Parenthood Prenatal Masterclass, it would have been a game changer.
And that's the big reason we put this course together, to provide parents with access to a reliable, comprehensive prenatal education from the comfort of their own homes and the ability to watch it and rewatch it when and where they choose.
Plus, it's got so much great information about preparing for the 4th trimester, which I'll admit, I felt really unprepared for. We focus so much on labor and birth when we're pregnant without understanding how challenging breastfeeding in the 4th trimester can be.
I hear ya. And that's why we put together such a comprehensive module all about what to expect for the 4th trimester and for your newborn.
If any of you listeners are pregnant and thinking about a prenatal course, I may be biased, but I would 100% recommend our online course. Head on over to www.shefoundhealth.ca/masterclass to check it out.
We promise you won't be disappointed or your money back.
So an epidural greatly reduces and sometimes even eliminates contraction pains. Pressure and discomfort can still be felt during the delivery. And once an epidural is in place, walking is generally thought to be limited to small distances. So they talk about a walking epidural, but we're not talking that you're going to be walking the halls. You might be able to walk to the washroom in your room or walk to the commode if you have an epidural in place. But generally speaking, it can change your sense of balance and affect the strength in your legs while it's in place. And so we don't want you going too far because we don't want you falling or injuring yourself. So some people still do have some discomfort, as previously stated, especially when delivering their babies. Others can feel nothing. So after the epidural is placed, it usually takes about 15 minutes to take full effect.
Now, occasionally epidurals do not work well. And if this is the case, the doctor who placed it can try to replace it. And it's important to know that about 1 in 100, about 1% of people can get a post-dural, aka spinal headache. And rarely, very rarely, a direct injury to a nerve or infection or bleeding in the epidural space can happen, causing nerve injury that could be permanent, but this is exceedingly rare. The most common side effects we see are that it can really lower your blood pressure. And so we're mindful of this, and you have an IV in place, and if your blood pressure does drop, we can always give you a little bit of extra fluids. It can make you feel cold and cause you to shiver, and some people find they get itchy from some of the medications that are in that epidural.
So one thing we mentioned earlier is a spinal. So a spinal is a little bit of a different procedure than an epidural. It's generally used as a one-off dose of medication for something like a cesarean section or a forceps delivery that we have a bit of time for. So this is when the anesthesiologist gives you one dose of medication and it lasts for about an hour and a half. So you don't have that catheter left in place. So this is for a shorter period of time. So if you're having a elective cesarean section, then you would get a spinal anesthetic beforehand, not an epidural catheter in place. If you've been laboring and end up needing a cesarean section, oftentimes we can use the epidural that's already in place and just give you extra medication through it to numb the area a little bit more. And for the vast majority of people, this is effective. Mm-hmm. So we thought we'd go through some of the common questions that we get around epidurals in labor.
So we often hear from people that they worry if they get an epidural, they will seem weak, as our bodies are made to deliver babies. I'm doing quotations here, and it is a natural process. So speaking as somebody who has had 3 births and 3 epidurals, it's really important to think about this in context. So we often say, no one I've ever met would want to have their bone set after a broken bone or have their appendix out without pain relief. And it's really important to know that a birthing person, a woman, has not failed if she requires pain relief during labor. Quite a few studies have indicated that most women and most pregnant people underestimate the level of pain they may experience during labor. The American College of Obstetricians and Gynecologists say that there is no other circumstance in which it is considered acceptable for an individual to experience severe pain. Amenable, that means it's available, safe pain relief is available while under a physician's care. And giving birth is no exception. You have the right to access appropriate pain relief. It is not a sign of failure. It is a sign of knowing your body and knowing what is right for you.
And if you choose to not want pain relief, that is 100% your choice as
Totally.
well.
Yep.
But it should be available to people who would like pain relief, and that's what we're talking about.
Yeah.
But everyone's pain experience is very different, and every labor is truly different. There are so many factors, as we touched on earlier, that can influence the amount of pain that people experience during labor. And that includes baby's position, which you have no control over. And sometimes if your labor is not progressing, we give medications to make those contractions stronger. And the stronger the contractions are, the generally more painful that they are, but also the more effective they are. So you don't have control sometimes over what your body does or what your baby's doing. And so it's hard to control your choices before going into labor because we really don't know what you're going to experience in labor. So the question often is, do epidurals slow down labor? And there have been a number of studies comparing epidurals to opioids. So this is morphine and fentanyl that we would give you through the intravenous or through a shot in the bum. And it actually shows that epidurals can shorten the length of time it takes your cervix to dilated, as long as you're 4 to 6 centimeters at the time of epidural placement or after. And a large review showed that it only lengthens the time from full dilatation, so when you're fully dilated, to when the baby is delivered by 5.7 minutes. So there's a lot of stuff going out there, how it really lengthens labor and how it slows down the pushing phase, but the studies actually haven't borne that out.
And I might add too that two big things to consider. One is that if you're really experiencing a lot of pain, you're going to be holding tension. So that epidural will actually help your pelvic floor relax. And a question we get is then, if I can't feel, how will I know how to push? And so that's one of the reasons why we do recommend connecting with a pelvic physiotherapist during pregnancy, as they can show you how to engage those muscles and you can almost practice what that's going to feel like.
Exactly.
So another question that we often get is, what about increased risk of cesarean section or assisted deliveries, like a vacuum or forceps assisted deliveries and epidurals? Is there a relationship? And we can't state this long enough or loud enough or often enough. Multiple trials have shown that there is no increased risk of cesarean delivery when comparing people with epidurals to those without epidurals. And when using a low-dose epidural, which we use here in our center in Victoria, and I think it's probably quite common in most birthing centers across the country, studies have not been shown for epidurals to increase the risk of vacuum or forceps deliveries. So it's really important that you do that.
And one of my favorite questions is there a point at which you've missed your window for an epidural? And the answer is no. So the only time that I would say is, like we discussed before, it takes about 15 minutes for an epidural to kick in. So if we think you're going to deliver your baby within 10 to 15 minutes, then probably you're not going to get the benefit of the epidural. And so we would advise against it. But for the vast majority of people, no, you can't get an epidural too late. I've gotten it for people who have been pushing for an hour. And again, they're holding their tension and they're really struggling to push against the pain. And so we get an epidural and then it just allows everything to loosen and they're able to push much more effectively because they don't have that pain associated with the pushing. So, yeah.
And even if you get it and then you deliver 15, 20 minutes later, there's still the placenta that has to deliver. There's oftentimes a repair that has to be done, and having that anesthetic on board can be really beneficial. So unless the baby's out, you probably have time.
Yeah. So let's just recap. In most people, labor and delivery are painful, and this level of pain can be influenced by many things. And we as birthing people have no idea how we will react or cope with this pain until we're in the middle of it. So making sure that you have some coping strategies and techniques that you've practiced before labor is really important.
Number 2, it's really important to understand that there are non-pharmacological, so natural, and pharmacological or medicinal methods of pain management that we should all have access to if we want to help cope with this pain. No woman or birthing person is weak or has failed if they choose to use any of these methods during labor or delivery.
And number 3, there is no evidence that shows having an epidural slows down labor or delivery by any appreciable amount, nor does an appropriate epidural cause a higher cesarean section or assisted delivery, i.e. forceps or vacuums.
So there you have it. Epidurals in a nutshell. Hope this was helpful, and head to our show notes to download our epidural handout as well as link to those podcasts that we mentioned earlier.
Have a great day.
Thanks for listening. Make sure to check out our website at www.shefoundhealth.ca and to sign up for our community for weekly bump blasts. Make sure to check us out on Instagram or Facebook at she.found.motherhood and head on over to your favorite podcast app and leave a review and a 5-star rating. If you enjoyed this podcast, take a pic of yourself listening to it and share it on social. Make sure to tag us on it so we know to keep making them.